We've said since the beginning our reporting on COVID-19 is about facts, not fear. Many of you have said if that's the case, then why not report the number of people who have recovered from COVID-19 as well as the number of people who have confirmed cases? We hear you and we want to do that, but right now we can't. Zach Merchant is live to explain why.
Yeah, Lori, we would love to be reporting those recovery statistics. Big part of facts, not fear, is context. More information, more accurate information helps us all better understand this. And for many of us, the uncertainty is one of the biggest challenges we're facing right now. Because of all that, we would love to be able to report the number of people who have recovered when we also report the data from the people who have new confirmed cases and who have died. But at least right now in the state of Georgia, there's no reliable way to do that. Here's why. The first and maybe simplest reason is this. Nobody really knows how many cases of COVID-19 are actually out there. Over email, Michael Hawkinson with the North Central Health District says they're only tracking lab-confirmed cases, and there are likely many more people out there who have it but don't get tested, either because they're not showing symptoms or for some other reason. If you don't really know how many people have it, he says you can't accurately tell how many people have recovered from it. In fact, he says the NCHD isn't even trying to track that data right now. They have their hands more than full with other time-sensitive work, like tracking down known cases and trying to limit their spread to others. According to Hawkinson, that's the case at all Department of Public Health sites across the state. In short, the Georgia DPH isn't releasing this data because they're not tracking it right now. All right, well, what about the data on the Johns Hopkins University website? Lots of you have said it shows recovery data, and it does, but not in the way you might expect and not in the way that helps us here in Georgia. The main dashboard shows recovery statistics for the entire United States, but in the fine print, the site says that figure is just an estimate, quote, based on local media reports and maybe substantially lower than the true number. And according to an email from Johns Hopkins media representative Douglas Donovan, the Hopkins dashboard is not currently tracking any recovery data in any individual U.S. state. In other words, they don't have Georgia recovery data either. That we want to be reporting these recovery statistics, but as you just heard, there's really no reliable way to do that just yet. That does not mean we're going to stop reporting on recoveries, though. We might not have the statewide data or the local data, but we can still keep reporting on individual stories of recovery. So if you're out there and you've been diagnosed with COVID-19 and you've beaten it, first, congratulations, and we are so happy to hear that. And second, if you're willing, we'd love to help share your story, share what you went through, what it was like, and how you're doing now. So if you're out there, let us know. Lori, back to you.
That would be a great story. Thank you, Zach. And you can direct message us on our Facebook page or email us at news@13wmaz.com.